All right, there we go. Okay, I think we're live. Okay, let's see. There we are. I think that's gonna work. We'll give everybody a minute to find their way over here. I know I just did a live on Mr. Pops at my main channel, which I don't really do lives on anymore because they have demonetized that entire channel. It's just, I know I say that a lot, but it's sad. Becky, hello. Thanks for coming over. Good one, Susan. Hello. Kathy Brady from Texas. Janie, hello. Skeed or Skied, hello. Lindsay Smith. Now people are showing up. Very cool. Let me see how many we got here. Ohio is in the house. South Carolina in the house. I found YouTube kicked me around a little bit. Doris, I know. They are not giving, somebody told me the other day, they're not giving updates when I go live or when I'm doing stuff. The other thing they do is called shadow banning, where you have to spell my name exactly correct or you won't be able to find me. Another unfortunate thing, just trying to educate here and have a good time. Somebody just got to go crappie fishing. Very cool, Beth. Hello from Louisiana, Nada. Why is the channel demonetized? That's a good question. Because it has pimples on it, one, which is crazy, but the other because there is some blood and there are procedures. So I'm not, doesn't bother me so much about the procedures. It's the non-procedures. It's all my other videos where I could do follow-ups and just interact. Those could have been monetized and actually would have made my channel, break even and make a little bit of money if that were the case. So it's unfortunate that they do that to entire channels when there's only segments of videos that are actually going against the guidelines. Yeah. It's unfortunate. But we got over 100 people. Very cool. So I want to talk about what I'm going to talk about today. And I'm not going to make you wait a long time for you to see his after. And this is even before his 4th session, which is very cool. We're going to get to that in just a minute. Wanted to talk about, just real quick, Memorial Day, remembering the people who sacrifice everything or sacrifice time with their family. So, here in the United States, we have a lot of freedoms. And, I'm very cognizant of that. I have a lot of people who are come in that are veterans, and for many different reasons. Some of them just met me along the years, and sometimes I'm closer than the VA hospital. Sometimes the VA hospital, especially in specialties, in particular dermatology, can be booked up like months in advance. And sometimes they have a skin cancer or something that's going on. So they want to be seen quicker. So I actually see quite a few, and great people, all of them, and I'm happy to have them. So kudos to them, and thanks for their sacrifices and for their service for sure. I just mentioned this on my other live. A lot of people are coming in that have found me on YouTube. I practice in Corona, California, which is Southern California. If you look up in that city, you'd see where I'm at. People have found me and are coming in. One thing I just want to make sure, for cash patients, the price is similar to what Medicare charges. So it's not super expensive, but I can't always do the procedure on the initial consult, especially if it's a big procedure. I have to do a consult first to see what we got going on, what I'm going to need, if you need to be under general anesthesia, and if I need to send you sometimes to general surgery. I do have people come in with very large lipomas, especially on the back. They're difficult to fully anesthetize, even with tumescent, which is what Dr. Lee does. They can be hard at the bottom. It's a hard thing to do in office sometimes. So a lot of times those will go to general surgery. So it's good to get that consult just so we can talk about it. That's important. I think it's pretty impressive. We have 125 people here, and on a channel that has almost 500,000, we have 400. We only have 18,000 here. So I think these are like the diehards. I really appreciate all of you. This is actually given us some freedom here. Mr. Pops It Live is monetized. I don't show like full pops or anything like that here. And I am going to be I'm trying to get into some more pop talk, which is talking about different diagnoses and having a back and forth with all of you, which I think will be very cool. And, you know, I can't do one-on-one consults on here by law, actually, but I can talk about conditions and sometimes about some of those protocols. So good morning, New Zealand, Christina. So we're going to talk about that. And at the very end, I'm going to open up for some questions if you guys have questions that you wanted to bring to the table. We just got back from a little mini vacay for parents. So, you know, Mrs. Popsit and I, we went down to Huntington Beach. We stayed at a hotel there for just like 2 days. It was like 2 nights, actually, kind of a full day and a half day in the morning. For all you parents out there, it's so important to, you know, have a small break, especially when your parents are young children. They can really wear you out and make you tired and keep you so busy that you're like 2 ships passing in the night sometimes, especially if you're both working. So it's important. I know it's easier said than done sometimes, but to really make that time for one another, because your bond is what's keeping the whole family together. So it's important to you know, make that time. And we did. And it's been very, very cloudy here and cool in Southern California. So we still, you know, we still went out, and even when it's cloudy, remember sun protection, because UVA still goes through. You can still get horrible sunburns on cloudy, overcast days. So make sure to remember that. That's very important. And we had a great time. We just got back. Was it yesterday? I think it was yesterday. Yeah, it was yesterday. It's all been a blur. So yes, let's get to this acne video, and then we're going to do a little discussion about his case in particular and kind of acne overall. So let me put myself in the corner here. Without the button to close. Okay, the button to close it is right by where I have to click. So here is his reveal. And first of all, I want to say this guy is just super cool. And he's super nice and just a great young guy. He's so excited to graduate. He just got his braces off. And he's doing great. So I have his before pictures on here too. So Carrie, so very cool. Sorry, I didn't get to it quick enough. I know you got to go, but here we go. Gonna play it. All right, guys, here we go. This is my severe acne patient, and you can see here, I was like, where's my patient? I didn't recognize him when I walked in. He's looking that good. That's his before. So when we come up on the forehead there, I don't even think he has one, maybe one here, but maybe 1 or 2 total. Then you can see on the side, we probably got 15 to 20. We'll be able to get there. A lot of his big inflammatory ones that we injected went down. He does have a new one here on the lip we're going to get today. But, whew, that was his before on the other side. And then we see on this side as well, he had that severe inflammatory nodule there, completely gone. I don't feel anything there. He had a couple down here we injected, totally flattened out. He has a little new one here. And I was telling him, you know, we don't cure acne, we control it. So it is going to, you know, he'll flare here and there. But as we clear out these blackheads and he stays on the retinoid, it's going to make it harder and harder for him to reform those blackheads, because it's reducing oil production, exfoliating dead skin. He's not going to make enough dead skin and oil to clog the pore again. Just a couple here and there, but that's about it. So looking great. This is what we expect, and it's just in time for his graduation pictures. He's loving it. That's right. And we've been watching the comments. He appreciates all the support too.
Oh, thank you guys.
Absolutely. And I mean, just overall, such a smooth presentation. That's what we like to see. So we'll get him prepped and ready here. I'm just going to do a couple more today, and this will probably be close to his last one. Okay, so that was his, and it doesn't look like he has a ton there. He's got 20 or 30 on each side, and the big one on the lip is actually surprisingly big. So I just finished editing that video, which was his 4th session, which is going to go up right after this. So Let me see here. Let me make myself bigger. And yeah, so you guys hear first that we're going to be doing his next video. So yeah, he's doing great. And a couple things I wanted to talk about with acne, and it's what I say on my consults also, especially when I'm talking to parents, but young adults as well, is set realistic expectations. So expectations are everything, especially with teenagers. And make sure to repeat yourself a couple times because sometimes they're not always listening as well. But yeah, he's smiling so big when he comes in. He's joking around with my medical assistants. A huge change in his demeanor from when I first saw him, and he was just kind of sitting there and wasn't smiling. And I'll tell you, it's one of my favorite things to be able to do for somebody is to give them confidence. And you know, it's everything, especially for a young adult or young person and teenager. So a couple things to remember. There's different types of acne, and you know, he is definitely in a severe category. People talk about Accutane a lot, isotretinoin. It is a medication that we utilize quite a bit. Very effective. Does have side effects. You know, I mean, there's people that have side effects to Tylenol. You know, so there's some people that have sensitivities, and it is a strong medication. And you know, you have to do blood work and make sure you're checking the liver. He would definitely have been severe enough, but he's a perfect example of. They did some clinical trials with tazarotene, which is a very strong topical retinoid, along with an oral antibiotic against isotretinoin or Accutane. And it did like 90% of, or 90 to 95% of what Accutane did as far as lesion count reduction and improvement. So, you know, especially for people who are mostly breaking out on the face severely and not so much on the body, but that's impressive and expected. I do expect that when you have the right topical retinoid and a strong one, it's doing what the oral retinoid does, where you're applying it. As long as they're applying it correctly, it is reducing oil production and sebum production, shrinking the sebaceous glands, and a lot of times permanently, and exfoliating dead skin cells that are clogging the pores. So it's like getting a microscopic facial every day. Drying up acne that is on the face, and then it's preventing future acne with that oil reduction and the exfoliation. Now, it's important. Hello, Kathy. You made it just in time. It is important when you're setting those expectations. A lot of them are going to be on very strong topical washes. They usually have tried everything over the counter. So if you have somebody that's doing a salicylic acid wash and then putting on topical benzoyl peroxide cream, and you don't talk to them about what they're using and you just throw a retinoid at them, they're going to get severely irritated and usually stop and not get the improvement. So, you know, I talk with so many, you know, as I go to conferences and things, I talk with a lot of mid-level practitioners, which are nurse practitioners and physician associates or physician assistants, and how that a lot of dermatologists utilize them to see the acne. And, you know, there's a lot of dermatologists that see acne, but they do a lot of other things as well. So a lot of other things that make them more money, and so Mohs surgery in particular, or different types of surgeries. So they're utilizing these mid-levels a lot of times. And I have seen, not where I work, but other places I've been, dermatologists who are kind of frustrated seeing acne and just kind of come in and out of the room. They don't explain a lot and just give a couple medications and don't have that conversation. So, you know, I take the extra 6 or 7 minutes to make sure to remind them that a gentle cleanser is important. CeraVe and Cetaphil are two brands that make cleansers to be used with topical retinoids. Cetaphil Gentle Foaming Cleanser is one of them, which I really like. Another thing is Dove has some great gentle cleansers. You want a gentle cleanser when you're on that, and you do need a moisturizer, even if you're using it correctly. And I always tell people when they start a retinoid to ease into it. Don't just put it all over every single night right off the bat. Even on weak retinoids, that can make you peel unmercifully. And, I mean, seriously, you can. It's like it can peel your face off like you had a glycolic acid peel with an esthetician or something. So the other thing is, if they are doing esthetician or meeting with estheticians and getting peels, they need to stop the retinoid 5 to 7 days before they go in, because that exfoliation, they can get a more severe burn from their peels that they're doing, or even at home masks and things like that. They want to stop beforehand. So these are all important things to remember. The other thing that I tell young people is, and this is so important. 1 out of 5 people will flare in the beginning, and they'll kind of have a flare and get worse before they get better in the first 4 to 6 weeks. So, if you don't tell a teenager that, or an adult too, almost 100% of them, when they get worse, quit what you gave them and then blame you for making them worse. So it's so important to say, hey, it's not the norm, but 1 out of 5, it can kind of purge and bring everything to the surface. So that is so important. And as long as you tell them that, then they're fine. They get through it. They just power through it and keep going. And then they get a lot better, and they get the benefit of the medications that you're giving them. And then, you get to see them on follow-up. They don't go somewhere else because you made them worse. So that's so important. Realistic expectations. I tend to do a 3-month follow-up. I know some people do a 1 month. In clinical trials, and a huge trial had like over 100,000 young adults. It took around 20 to 40% improvement in the first month, around 40 to 60% by the second month, and 60 to 85, 90% by the end of the third month. So if you really want to evaluate if your treatment protocol is correct and it's the right strength, by the end of the third month, you should have enough information. If they're 30 or 40% better at the end of the third month, you're probably not on the right protocol. And usually that's increasing the retinoid strength, maybe adding an oral antibiotic if you didn't originally. And there's different types of hormonal acne with females, because they have cysts on the ovaries or fibroids in the uterus or endometriosis. Endometriotic tissue down there, all those things can play a part in big inflammatory nodules. And generally there's different, and I've mentioned this kind of in passing before on some lives, but that can be, sometimes we utilize birth control. It's not my first go-to, but sometimes it works. Spironolactone or aldactone is another one. It's a potassium-sparing diuretic, but is used off-label. It's not for blood pressure by dermatologists and dermatology PAs and NPs all the time, because it binds to the hormones that might be fluctuating high because of inflammation in the uterus, or inflammation in other areas because of cysts. And you can't stop the hormones, but you can bind and inactivate them so they can't cause as much inflammation. So setting those expectations, you just have some adolescent acne, which is just the hormone fluctuations of growing, and being 12 to 16, or even at 9 or 8 it's starting. As you still have growth plates on your bones, that's signaling to your body, hey, we need high levels of hormones. We've got a lot of change to do. So when those growth plates are done, generally 16 to 19 for women and girls, and 18 to 22 or 21 for males. When that's done, the hormones actually kind of come down a little. They're still high at 20 or 21, but they actually kind of level out a little bit when the growth plates are gone, and that's just signaling to the end of adolescence and that all that growth and change that happens. So it's take a shot. Rub. I do rub this hair here. I like that, Paul. That is a habit of mine. I used to chew on a pen too, but I stopped that. So that's funny. I took a shot. But I actually really enjoy acne. And a lot of people don't, or sometimes like, oh, another acne patient. I think it's such a great opportunity to really easily differentiate yourself from other practitioners if you do it correctly and I see so much acne. I do speak fast, but I have it written down, and I have my protocols that I give them, and I do enough follow-ups to make sure I have them on the right path, and I course correct if not, and get them to where they need to be. So, and there's nothing better than seeing like this guy that we just showed right here, all smiles, man. It's so cool. And, they come back sometimes just to say thank you. They don't even need anything else. They have refills. They'll make a follow-up just to come in and give me a hug or to say thank you, which is very cool. And it's very fun to do. So, yeah, this finding somebody who takes the time to really explain things. There's a lot of people out there, a lot of different offices. If they're not doing it, next. Go to the next person, until you find that person that really takes their time for your particular type of acne. And there's so many different types. There's torso acne, there's acne in males and females. There's acne before pregnancy, during pregnancy, and post-pregnancy, post-breastfeeding. There's lots of different types of fluctuations. Hello, Scotty. Hey, he made it with his cat. His kitty's probably big now. But yeah, so, find that person who speaks to you correctly and takes the time and listens to what you're saying and gives you something written down. I always give them something written down too, so they don't have to remember what I said. So that's important because it does take some time to get there, and they do need follow-ups and reiteration sometimes and reminders of how to use things. And there's a lot of different medications on the market that we can utilize now that work great. So that was good. I just wanted to thank all of you on Mr. Popsit Live. I'm actually getting some ads, not a ton, but it's very cool to actually have like a real YouTube channel that's normal and actually can get some ads. So that is fun, and it's been growing. And what's really been working is that I make these lives, and as I make these lives, I tag them at the end of my normal videos on my regular Mr. Popsit channel, and that is what is getting the views. And it's great, and I really appreciate it. And I was getting 1 million views a day. I've been getting 500,000 to 1 million on my main channel. It's unheard of. That's thanks to all of you. It's pretty amazing to have that many views. I see channels that have 2 million subscribers that don't get that many views. They have half the amount of views that I do. So that's pretty amazing, and a testament that you guys like to watch these videos. So I appreciate it. So I think now we can I'm gonna, if anybody had any in particular questions, I can't diagnose things, but thank you for Carrie's Jones. Thank you so much for the super sticker. I appreciate it. Every bit helps. Let's go. That's right, Wani. So yeah, as far as like somebody was talking about rosacea, yeah, I'm probably getting a lot of multiple views. That's exactly right. People are watching 2 or 3 times, which is great too. Sometimes people go back to see, they can't believe what they saw the first time around. And I have a couple very big cysts coming. I have a lot of steatocystoma multiplex, and I have a lot of people are coming in and driving a long ways to come see me for that, which is amazing. It's why I started the channel, is to educate, and they really are, finding me and coming out. I've had a couple to drive an hour and a half, 2 hours just in the last month. So I did some test spots on them to make sure they don't hyperpigment, and we might be having their videos coming soon as well. But I have my patient that I've done 2 or 3 videos now. She has 8 total, and man, the 3rd, 4th, 5th ones are pretty amazing. So they're coming soon as well. So keep your eyes peeled on that. And then, oh yeah, thank you so much, Kathleen Cooney, for the super sticker. I really appreciate, every bit helps with these YouTube channels. I had never had a YouTube channel before. I was not a YouTuber. I just kind of jumped in, and I had no idea what it takes, which is, people just kind of dive in head first sometimes. Just the business side of it and setting up everything and the lawyer's fees and oh my goodness, it's quite a bit actually. And I see why, somebody was talking the other day about all the people that are leaving YouTube, especially that do what I do, and doing these medical videos. They just kind of stopped posting them. And it's because it takes quite a bit of editing and all the time and what you have to do to even have ads. And when they take the demonetization, it is like yellow tabs or red tabs, and it's like about 0.07 of 1%. So you do get a couple ads. I am getting a little bit here and there, which is nice, but it's nothing compared to like the Hoof GP, the guy he's got like 4 Ferraris. I've seen him lately. It's crazy. Um, but yeah, oh, thank you so much. I think a super chat from CDN full of questions. Why are there people out there re-upping pimple videos and adding it to the end? Yeah, good question, and thank you for the super chat. Uh, I think one of the reasons that they demonetize some of these videos like this is there is a huge group of people out there that are very interested in them, and because of that, people steal the videos. And I was getting 10 to 20 videos a day stolen at the peak before they demonetized entire channels. At the peak, it was a lot because if I didn't go on and report it, and they have good software that catches it. If I didn't go on and report it that they had stolen my video, eventually it goes long enough that I come up on their channel for having the same video, and they have the opportunity to bring a copyright infringement against my video. And that happened a couple times. So I have to go on there constantly and check, because if I don't, I get copyright infringements, and it's my face on the video and me talking. And it's like crazy. It's crazy. So I have to go on there and then do. I have had that happen to me where they are bringing that against me for a video that is my face on and I uploaded. It's crazy, and I think they got sick of dealing with that too. And it must have been tens, hundreds of thousands a week, I'm sure, just because the amount I had alone. And even when I had, yeah, it's when I was writing on my gloves because I needed to do that. It was crazy how many videos I was having stolen. I still get about 5 to 10 a week now instead of 10 to 20 a day. But it's easier to keep up with that because, if I'm doing a video a week or so, I get on and I see it. But yeah, it's so weird, and I get it. It's probably troublesome for them to have to deal with all that copyright infringement paperwork, and you do have to send it out in an email. They have to ding those channels. It's very strange. It's very strange. And, a lot of people have said, why not charge for it? And there are a lot of people have, Dr. Lee does that. There's people who charge for it $2, $3, $4 a month. I thought about that. I tried to do the Mr. Pops It live instead, and I'm still trying. But yeah, it's pretty crazy. Some people have gone to like Patreon and different types of places too. So, that's an option as well. For now, I think I'll be able to get third-party ads as we're getting close to 500,000 subscribers, which is amazing. Thank you all so much. It's all of you. And I have a feeling that if I just keep my nose to the grindstone and we keep moving forward, 500,000 to 1 million subscribers, I will be able to get some third-party advertising. So, if it gets to the point where I do a monthly subscription, who knows? I don't think I will go that way because I don't want people that want to see their own videos have to go and pay. That's something weird about that to me. But at the same point, if you're putting in so much time, YouTube is still making plenty of cash. That's what somebody was telling me the other day. They're still doing the same amount of ads on all my videos. They have just dropped what I make by demonetizing me, which is really the knife in the back. That's what really gets to you. If you think about it too much, it can make you angry. That they just, they're still playing ads. There's still ads all over it. They're still making the money. They just brought down my percentage, which is unfortunate. because there is a lot of work that goes into this daily. But anyways, enough complaining. I enjoy it. That's why I'm still doing it. And if it turns into something where I can make a decent amount of money for my kids' college someday or something, that would be excellent. I am still studying, Donna. Thanks for asking. I'm taking it in segments, and I just had my second segment last weekend, and I got 23 out of 25. So I'm crushing it as a dermatology PA. That's pretty amazing. Something just dropped in the lake out there. I'm watching, but yeah. So yeah, it's going great, and thanks for asking. I'm still going that. I need to keep my certification, and that's how I do it. Is that baby girl? Does she want to come say hi? I think we're getting to the end here. Thank you all so much. We got 30 minutes in, and thanks for coming over here. Come here. You want to say hi? What do you got? Were you just taking a nap? Oh, look at this one. She has a little baby. You got a baby with you? Oh, can you say hi? Look at that. How old are you? 3.
And my baby's 2 years old.
Your baby's 2? Wow, that's amazing. Can you see yourself up there? You're getting so big, aren't you? Yeah. Addie Ray. I love you so much. You ready to say bye and tell everybody to have a good weekend?
Bye.
Yeah. Have a good weekend. Have a good weekend. We'll see you soon. Go play. Go play. She's a handful, but boy, is she fun. Yeah, that's a good idea, Heather, for sure. For those who want the early videos and want to, that way they still come out. I know some people do that. That they do a subscription for early videos. And heck, even if it's like 200 people, that at least pays the lawyer's fees. That'd be awesome. Thank you, Robin. She's so fun. But yeah, so I'm getting ready in the next 20 minutes here. I'm going to drop his next video, which will probably be, he's doing his pictures. I'm assuming he's going to bring a picture in of his graduation. So that should be cool. It's great to talk with all of you. Thanks again for the super chat and super stickers. Appreciate it. And we'll do it again soon. Thanks for popping by. We'll see ya.